Hi, Dr. Sasse here from Sasse Surgical. I'm just going to address today a topic that has come up since the sleeve gastrectomy has become such a popular and effective weight loss surgery. It's become the #1 metabolic surgical procedure around the world, and it has very few side effects over the long term we now see. However, it does have one side effect that is actually worse rather than better than some of its competitor procedures, and that is heartburn or gastroesophageal reflux disease. So the studies require a little bit of interpretation, but in general, while the numbers have gotten better over time, there is still probably 10% of people and maybe as high as 20% of people who experienced worsened gastroesophageal reflux disease after sleeve gastrectomy, as opposed to improvement of gastroesophageal reflux disease or heartburn after their sleeve procedure. Usually it gets better for a couple of reasons. One is because we lose weight and that takes pressure off the abdomen, less acid is getting forced up into the esophagus and chest, less heartburn. Another reason is because a lot of us surgeons are very attentive to the hiatus or the valve at the top of the stomach, and if it's loose, we tighten it and thus we prevent acid from sloshing up into the esophagus. Again, less heartburn, less reflux. So those are two powerful reasons why there's less heartburn in most people. However, you still get this subset of people who experience more gastroesophageal reflux. Part of that reason is because the sleeve itself is a little bit higher pressure inside than it would be if it was just draining out into a bypass procedure, which is a very low pressure outlet. So what do we do about it? Well, of course, we try just to control it with medications and with diet. And we also investigate why it's going on with a number of studies. Sometimes we look at the motility of the stomach, so that's a gastric nuclear medicine emptying study to tell if the stomach is emptying properly. Many people have dysmotility or gastroparesis as a result of diabetes or other reasons, and that may be contributing. Additionally, we usually look with an endoscopy to see if there's some scar tissue or a web of scar tissue or a stenosis that is partially blocking or partly obstructing the sleeve, because that can be stretched or dilated, and that can often allow better flow through and reduce that acid reflux as well. However, sometimes these remedies, medications, diet, endoscopic treatments aren't successful, and we have to start thinking about revising the procedure surgically. And how and why do we do that? Well, the most common way and the most effective way of resolving that gastroesophageal reflux is to convert the sleeve into a gastric bypass procedure. And you might be thinking, well, geez, I didn't sign up for the gastric bypass procedure. I'd really rather not do that. And that is absolutely understandable, but if you find yourself in this boat, sometimes that is the better path to take because of two advantages. One, it can totally eliminate gastroesophageal reflux in almost everyone. Think of it as bypassing most of the stomach, including the bottom part of the stomach where we come to the pylorus, which is kind of the four-way stop sign to empty out of the stomach. And so by bypassing that area completely, everything that we eat and drink could just flow down naturally right on into the intestine with a low pressure path and no stop sign whatsoever. So that generally totally eliminates the acid reflux. Secondarily, though, there's also a benefit of having that conversion to bypass because we can create the bypass in a way that's sort of modern standards and will usually jumpstart additional weight loss. And so that can be an added benefit as well. And so for those reasons, there are people who will benefit from, and oftentimes insurance will cover, revising their sleeve to a gastric bypass for those reasons. Normally in our hands and in the hands of people who do a lot of revision surgery around the country, and these tend to be the most experienced and best bariatric surgeons, it can be done with a laparoscopy with a short 45-minute procedure, something like that, with great results. Another type of revision might aim at the weight loss by going to the duodenal switch as a second step. However, that has less impact on resolving the gastroesophageal reflux. Sometimes people will have a large hiatal hernia, a very loose hiatus that has formed since the sleeve, and that can be repaired or tightened up to eliminate or at least reduce the gastroesophageal reflux as well. So it takes a careful evaluation. It takes a sort of a careful, conscientious surgeon on your side to kind of understand exactly what's going on and to try to resolve it for you. But rest assured there's some excellent cards to play to resolve that gastroesophageal reflux, and in most cases we can very successfully do that. In most cases, revising the sleeve to the gastric bypass is a very successful, safe, effective path, and one that may totally eliminate those symptoms for you, as well as jump-starting stagnated weight loss. I hope this video has been helpful for you, and if you have other questions about it, there's some excellent tools on our website and on other sites around the world that talk about this specific topic. So corroborate what I'm saying, of course, and I wish you the greatest health.